The
This
recording
conference will
started,
now be recorded.
and the nice little lady says the conference is going to be recorded, so now we know it's going to be recorded. Okay. So what we're looking at here, guys, is the demo queue. So it's not, any specific agency that we're looking at. We're just looking at a demo queue where people have tested the software, one of our demo queues. And so you don't have to worry about privacy and user privacy information or anything like that. The queue is set up to show you the mechanics of the service. What we also support is an FTP learning environment. So when I say FTP, I just mean a folder on the Google Drive where we put documents that help you understand the functionality better. That FTP, if we go over to just a second here.
John, should I be seeing your screen? I'm not.
I'm not seeing it either.
Thank you. Thank you. There's so many things I have to do to make this go right. And if I don't show my screen, then it's a big problem. So thank you. Okay. So we're looking at the demo screen or the demo inbox, and we'll log out to see what the login looks like in just a moment. Let's pop over real quick to File, New Window, and let's go to the FTP Google Drive. We'll go quick folder. There's an actual folder, I believe. Let me see, so this folder, guys, what this shows you is, we have a specific folder for WIC. We also have this folder for health departments. We work with a lot of health departments now. It's a growing area, right? So what was good for WIC is also good for the other departments or the other components of a health department. So when my drive shared with me, go here, share with me, and then let's go to the health department. Okay, so this is just, again, Google Drive, open source. Everything here is available for you to look at, download. I'll even send you the link. So what this, guys, does is this helps everybody get started in a way that's going to work best for them. So if you learn better by looking at a visual guide, well, then you can pop over to the shortcode guide and you can look at the PreventionPays text guide, and it'll take you through step by step how to activate your profile, how to have a conversation, and then how to close that conversation, how to send group messages, how to have conversations with groups that have been texted. All those things are handled in this guide, which is only about 19 pages long. So it's not very daunting. So if you learn better that way, great. We also do training. So we do web-based training like what we're doing now, but more formal in that we're focused, right? We're focused like a laser. We know what we want to teach you. So we're talking about it in terms of your settings, your conversations, right? The types of conversations and the types of encounters that you're going to have with your caseload, your clients. And so then when we do those training sessions, we also record those sessions so that each department could have a couple training sessions that are just for them, right? Just focused on the nuances of how you're using texting. We love the training component because we know how important it is. If you don't get on board at that time, then you're probably not going to get on board at a later time. So it's really an important, critical moment to launch the program and then to also train. So, and the training is, and it can be ongoing in that, we can record a session, launch, 2 months down the road, new staff turnover. Hey, we want to revisit training. We like the video, we use the video, but there's a couple people who are they would prefer to have a live session. And we want that to just focus on putting clients into the service and sending them texts. Okay, so we'll do an additional session and we'll do it with just those individuals. And we can choose to record that session as well if you like. That one would be more focused, right, on just specific features, but that too is available. Ongoing training. So we feel like, doing the training initially, great, gets everybody going, but what about ongoing staff turnover, all that stuff to consider? So we want to make sure that you feel like, hey, what everybody got at the beginning is also available in an ongoing format. And so this folder also has admin documents in it, and admin associated tools and things. It also has a document for those who are concerned with privacy, which are, there's definitely a cohort of individuals in each health department that are absolutely zeroed in on that folder right there. So if that's what you're coming to this FTP to have a look at, then you pop over into the HIPAA assurances and you could have a look at our protocols. By the way, our HIPAA protocols are now supported by SOC2, which just means that we have a third-party attestation that the way in which we are storing and archiving data is above or beyond HIPAA standards. And so that SOC third-party attestation is available upon request. We just do an NDA with your health department, and then they can look at those documents as much as they want. It just makes true all the things we're claiming here because it's a third party saying, yep, that's what they do. So if you have any questions about that, you can give me a call or give me an email, and I'm happy to zero in on that one or more information on that one. We also provide guys sample banners, JPEG posters and takeaway cards, things that are fun to look at, and help you with marketing. Maybe you've got a program that you need to provide a public component, right? So why start from nothing if you could start from something? So this is examples of posters that we've done over the years that are that help you understand how possibly you might develop a program around a print program around your texting, so that if you're gonna reach out to the public in the form of takeaway cards or a brochure or a web banner or whatever, however you're going to let folks know. It might be that the genesis of that work comes from the FTP because we put high resolution documents there. We also give you, like, if you like just the image here and the high resolution image and then the language that's used on another, you can mix and match, and we'll send you the high resolution for both, so that if you've got somebody there who has a little bit of Photoshop experience, then they can do those little changes, right? Put your own logo in there, or copy and paste information from one file to another, things like that. So this is all open source stuff and available for you to have a look at and learn more about PreventionPays text. Feature guides, right? So these are specific about the different components of the service. So learning about how I get my data, right? So the reports description guide drills down on how you get at your data. And it tells you what exactly is in each report. Then there's a staff creation guide. Health departments turn over staff a lot. So being able to create your own staff is wonderful. And this walks you through that. It takes you through how to set up a new staff and to set their permissions and do it and feel confident. And then there's a whole segment on appointment reminders, right? Because we do appointment reminders plus, right? Plus whatever happens next. Because appointment reminders are rarely just that, right? They're rarely just an isolated event. A lot of times I need to reschedule. Well, then how do they reschedule? Do they have to call a phone number, or do they text back? And if they text back, is there somebody that's going to reply to them? And if you replied, you have an automated conversational walkthrough that you can, quickly obtain what day they're going to want, what time of day they're going to want, and send them a new appointment reminder. So appointment reminders plus everything that happens next. And that's what this guide helps you do, is figure out how best to create and manage appointment reminders and compliance around that. Okay, so let's we've seen what the FTP has. Now let's log in. So let's log back out and then log back in. We'll log out and then we'll log in. Okay, so when you log in, you just use your email address and your password, right? And your password can be saved and you don't have to ever worry about it again. And then you can sign in, or if you want, you can change your password. This little link here takes you on that adventure. If you don't need to know your prior password to create a new one. So it's really user-friendly in that regard. However, once you create your own password, it is your own. We don't keep record of it for security purposes. Okay, so this is the queue. This is where you do your work. You'll see, you can compare it kind of to email. There's a little bit of similarities to email here in that email has an inbox. You can also compare it a little bit to instant messaging. So if you take email and instant messaging and smush them together, this is what you're seeing in a way. To opt in, I just can text the keyword, right? In this case, it's texting keyword demo to number 85511. So we use short codes. Short codes are tier one connections, meaning that all carriers, even tiniest ones, are supported, right? Even the ones that are Go phones, the pay-as-you-go or government issued, all supported. So nobody cannot text with you. Everybody is going to be able to do so. That is wonderful. Also nice to be able to know that your texts aren't going to be blocked or filtered or anything like that, right? Which happens with these other numbers that are out there. They get blocked. Carriers will stick them on a block list, or they'll do something else, right? They're coming out with draconian rules now about what to do with numbers that aren't legitimate numbers, right? The numbers that are provisioned with the carriers, and the carriers understand them to do what they're doing. If they're not, and they're not known, which is kind of what Google Voice is all about, right? But those numbers aren't known by the carriers. They're using internet protocol to send those messages. So Google Voice is ending, I believe. I think they're going to shut those numbers down eventually. With short codes, you know it. You know everything. You know that you can text with them. You know that they can text back to you. And you know that the messages that you're sending get delivered. We have delivery receipts. So when a message gets sent, we get notified from the carrier. We have partnerships with all of them, again, the big ones and the small ones, to let us know, yep, we got your text. And yep, we delivered it to that client's phone number. They use terms like handset and MT, mobile terminated text, things like that. We use, was the text delivered or not, right? Was it sent to the phone or not? And that helps, the carriers help us to convey that to you, to put that into the software. So when somebody texts and they opt in, we're going to notify you. We're going to update the queue. So I'll opt in, and I'll opt in by texting demo. So when I send a message to 85511 and in my message I send demo, that's going to opt me in. Now, we would set up a program with keywords that are specific to your program, and they will be specifically used by you only. So if somebody needs to text you, they're going to text the keyword for your program that you give to them. You don't have to broadcast it. You can just have it be that, here's the keyword that you text to this number and we're giving it to the people we want. Or you can put it on a website. Either way, like you could say text demo to 85511 and put it on your website. And then if people visit your website and they see that it would be like putting your number on there, right, for them to call. But instead you're saying you can text us. So when I send demo to 85511, we're going to see it pop in this queue. And we'll see it pop at the top. And then there's an audio alert, which I'll turn up a little bit so that we can hear it. And then for a new text that comes in, there's a beep, a soft tone. And then it blinks periodically. And then there's a notification window, so you never miss text. So you can have notifications that are a pop-up window that tell you have new text in your queue. Please answer them, right? Or you can have in addition to notifications, which is a pop-up window, which is inside the application. So you're still logging in to get those notifications. You can also have external, where we send a mobile number or an email account a notification. And that notification goes out to outside of the application, right? It goes outside of PreventionPays to the email inbox or the phone number, the mobile phone. In that case, the notification strips information that's private, right? It only gives you the last 4 digits of the mobile number, but it says you've got a new text in your queue from XXXXX, mobile number 0296, and you get that sent to your mobile phone. So then you're always covering. And if you have that type of service where you're trying to monitor and you want to make sure that you know when people text you, well, there's all kinds of tools that help support that. So you don't have to be logged in to know that you've got a new text from the public. When I click on this phone number, I see what transpires with this phone number. So I see all the outgoing messages that get sent to it. So I have messages that are scheduled to go out according to the keyword being texted. So when demo gets texted 85511, they're going to get a welcome message and they're going to get sample educational messages. And these are sample messages that we took from WIC, because WIC does this stuff really well. They do educational messages very well. So, but this is just sped up, right? It's sent in a very rapid way in the first couple of minutes of opt-in, just so that you can see the content and how it displays. You can have educational messages that go out weekly, right? And so when somebody texts the keyword or you opt them into that keyword, that starts the messages that they're going to get week 1, they're going to get this, week 2, they're going to get that, week 3, and so on and so forth. You can build your message tracks under the reminders tab. Very easy to do. It's kind of like building blocks. You have a parent message, and then you have messages that key off of the last message sent. So you can, it's like a ladder of messages that here's 20 seconds after this one. This one's 30 seconds after that one, right? This one's 3 minutes after that one, and this one's 10 minutes after that one. So you can build your series of messages very easily. We can also build them for you. We do that. So if you've got educational messages that you want in a message track or series, you can go, hey, PreventionPays, we want to set this up. We've got our message track all laid out. We want to do it English and Spanish. Here's the copy for that, and we'll load it up. So either way, you can build it yourself, or you can give it to us, and we'll build it. When you are having a conversation with a client, So different from educational messages, right? This is a one-on-one dialogue that I'm going to have. So kind of like a phone conversation in a little bit of a way, right? So I'm still getting those educational messages, right? Those ones that I'm sending as part of the series. But let's say I want to have a conversation with this 831 number. So similar to phone is them starting the conversation by texting you, or you starting the conversation by texting them. Then opening up the case. So open the case. So until I open it, I'm just looking, right? I'm observing. I can audit the program if I wanted to. I could be an administrator who's just looking to see, is communication happening as it should? When I open the case up, well, now I'm responder. So now I'm having a conversation, or I'm starting a conversation with this 831 number. If I made a mistake and opened that up, and no big deal, close it, right? So if you make a mistake, it's not, oh no, right? It's just close it. But that is the anatomy of a conversation. Opening it up, having the conversation, right? And then closing it. So let's look at that. So 831 rang us up, right? They called us by texting demo to 85511. So how are we going to answer it, right? In the phone world, we're picking up as it rings. In the text world, we're opening it up as it dings, right? The dinging noise, the audio alert, the notification, right? All those come with sounds. So we're notified that this person has rung us up, that they've requested contact. So we open up the case, and now I can either use my library or I can use a general library, right? General library versus my library. My library, I just see. General library, we all see. Okay? You can have queues that are set up for specific staff members. So don't think that you have to share communication with everybody. You can have personal queues, just as you can have personal inboxes in the email world. You can have personal queues in the text, PreventionPays text. So it might be all the canned phrases are the ones that are mine because it's my queue and my cases. Okay, so intros, right? Hi, how may I help you today? Because this person rung us up, that might be a good greeting. So I'll send it. So instead of typing, hi, how may I help you today? I just selected from my library of canned phrases. It's grayed out for a tiny bit while it gets sent. And then when it gets delivered, we update it. It's the carrier letting us know when it gets delivered. So it stays a light green for a tiny bit, and then it changes to dark green when it gets delivered. And then all your messages have those timestamps in delivery. So this person opted in at, let me see here. Oh, I don't want to use that bar. I want to use this bar. This person opted in at 11:28. Then I sent my greeting at 11:35. So what's that? 7-minute response time, which is measured, which is all part of the data that you can pull, and you know, you can have all that being calculated and measured and determined, right? What are response times? How well are we responding to requests for help? So how may I help you today? So that begins the conversation, right? So then they're texting back their need, and you're texting back your response to their need. I have to apply for, keep it simple. So I'm just texting back. I have to apply for a benefit. So now blue is from end user, right? Blue is always going to be from the client, and then you're green. And that's it, right? And then you're conversing back and forth until you meet their need. And then when you're done meeting their need, you can close it. And you might have closure messages that you use, right? Thank you for contacting the university. Well, that's not us, so we can edit that, right? You have complete control over the content that you use. Right? If you need future help if you need help in the future, just text UNI demo, right? Or demo to restart the message, right? So I could edit this, or I could edit it in the canned phrases library. Either way. I'm just going to edit here. Demo. And then thank you for contacting. Today, right? So then I send that message out, and then that's my closure message. And then if we're not going to have any further conversation, well, then I just close it out, right? So I might have a bank of messages that I just use for different stages of the conversation. And like I said, when I'm done, I close and archive it. So let's say I've got a client that I need to send a text to, but I'm not going to have a conversation. I just want to send a text to them. Well, I can go to this referrals tab, and I could put my number in here. I could put a single number, or I could put multiple numbers and comma separate them. Or I could have an Excel spreadsheet of numbers that I'm texting to that I browse and upload. So 831-332-0296, use my number again, and then my content of the text, right? This is information about the appointment next week, yada, yada, yada. And then I send that to my phone number. I just need to know the keyword that I'm going to use. You can use the keyword demo, but it's going to send them the greeting, and it's going to send them those automated messages. So if I'm just going to text content that is in this box to this mobile number that I put in box number 1, then I want to use a keyword that has nothing associated to it. No opt-in messages, nothing. And that's the silent keyword. So when we put a silent keyword into your program, that means that you can use it for just that, sending content to a phone number and not have it be an opt-in or any other content going out, just the content that you want to send. And then you click send, and then it tells you your messages were sent to the client. And that's it. Super simple. Very easy to use. Very intuitive, user-friendly. You put the number in here, you put your content there, you send. So sending messages to phone numbers or callers is very easy to do as well. When we go back here to the Users tab and we look at that phone number again, when you send content to a phone number and it's silent, we don't update the queue the way we do when it's a standard keyword like demo. The demo highlights, it goes to the top, it blinks, all that. When we send content to a phone number, well, it's quiet. It doesn't highlight. It doesn't update because it's one way. We're just sending content to that phone number. You can still go to the queue and find it and see that it happened. There it is. And there's the keyword. And there it is highlighted in blue, lighter blue, because we use the application to send that content. App referral. And then when we scroll over, we see that it's delivered. Simple. Let's say I need to convert a caller to a text conversation because I don't understand what they're saying, or I or they don't understand what I'm saying, or they're going to have to hang up the phone unless we convert them to a text conversation, which happens. People have to do things, or maybe they're in trouble, or maybe, they want to, they just feel better or would prefer if they could text you. So you can take their number and you can go to copy it. You can go to, and you can, this would be external, right? You have the number, you go to fully opt-in, you put the number in the box number 1. And this is if we're converting a call to a text conversation. So then this would be a case where we might want to use the demo keyword, because then we're going to send them the greeting, and then we'll send them the whatever conversation we're going to have. So I can convert a caller to a text just by simply using one of these tabs, the fully opt-in tab. And when I send that, the same thing will happen as if they had texted demo, but instead we put them into the queue. So when we go back to the users tab, we look at this phone number, there it is, and there's the keyword, and then it's lighter blue because it's an app opt-in, but then there's the greeting that we send for when the keyword demo is used. And then we've got these unsent messages that are going to go out, these sample messages that will go out as well, right? Based on the fact that we assign those messages to that keyword. But you can cancel those, you can remove them if you don't want unsent messages to go out. If you assign somebody messages and you want to change that and remove them, you can delete them and stop unsent messages from going. Okay, so the other feature that I wanted to show you guys before we jump into questions is Groups tab. Now, Groups tab lets you group phone numbers together and send them content. Simple as that. Any group, any content. So a group can exist by virtue of opening up cases and finding them and opening them, right, in the queue. So I've opened up this one, I've opened up this one, I've opened up this one. As you can see there, I'm now open on 4 cases. And I've got my primary, the 651, which I opened up last. Then I've got all the way back here, this other 651, which I opened up earlier, right? And it goes to the background. And I can hide this, and I can look at all my cases that I've opened. So it's really cool. You can send now content to all of them in one fell swoop. So I can go over to the Groups tab, and I can go Cases I Own 4.
Jonathan?
Send content. Yep.
When you're done with this element, can I ask a question? I don't want to interrupt in the middle.
Yeah, we're almost done. So when I select those cases back at Users tab, they became my cases, right? So now I've got 4 cases that I own, and I can send content to. Hi, I have a question. Please text back as soon as you can. Or hi, this is Jonathan. I have a question about your application. Please text back. Whatever the case is, you've got to reach 4 people, and calling them just hasn't been working. And other strategies haven't worked. So let's text them. And you'd be surprised how many you send that text out, and they all text back within minutes. So you go back to the Users tab, they all get that group message. You'll see it in their conversation. And then as they send their message back, you'll see it update in their conversation. And then whatever one you view, that's the one you're conversing with. So if they text back all at once, well, then you may want to just pick them off one by one. Or you can respond in a group way if it works. If sending everybody the same response to what they've responded to at this point, you could still do that. Or you can one by one individualize them at that point. Either way. It might be better and less confusing to individualize them. So if I need to respond and I see that 515 has responded to my text, I just click view, and then I'm texting with 515. Oh, 831 responded to my group text. Oh, I'm going to hop over to 831. I'm texting with 831. Simple. When I text a group text and they send a text back, just I get their message, not everybody. Just I do. So it's not group texting. It's only group texting one way. It's not group texting both ways. Because we've all been in a group text before where you send everybody the text and you go, oh my God, I can't believe I just sent all those people that text. That's not how this works. When they send back their reply, just you get it.
Okay, Jonathan,
okay, so
can I ask a question in the interest of time, since we only have about 10 minutes left?
Sure.
I don't know if other people can stay on longer, but
sure. Let's go. Let's ask some questions.
I don't know. I wonder if those program supervisors on the line can chime in with the functionality that they really wanted to use most. I'm not aware of people wanting to send out prevention messages and such. Maybe that is the case and they can tell us that, but I think the main function that folks are wanting to use is to have these sort of one-on-one conversations with people and to schedule appointments.
Sure.
Is that correct? Sure. Francesca, Barry, everybody on the line?
For CCS, we want to do automated appointment confirmations. So we want to print a report, generate a report out of Centricity with the appointments for probably 2 days away, because we want to give them more than 1 day confirmation. Print that report, and then the system will automatically generate text to those clients that are scheduled for appointments on a particular date.
So so you just, as long as your source document, the one that has the appointment reminders on it, as long as it matches up with the columns of information that you create in PreventionPays, so you can match the columns in appointment, your templates here. So whatever document you export from Centricity, I think you said, then that document you need to save as an Excel, and then you need to match the column headers in that document with the column headers in your template. And then you can send as many appointment reminders as you need to send out. And they can be confirmation appointment reminders. They don't just have to be, this is your time and date that you are coming to this appointment. It can also be to confirm your appointment, reply, right? And you can give them options. And then if they confirm, great. If they need to reschedule, well, then it's something different. And then you can use the application to either automate the exchange that happens then, like if they need to reschedule, you can have an automatic Q&A that happens that is triggered by them requesting the reschedule that says, I see that you wanted to reschedule. Please choose the day of week that you would prefer your new appointment time. And then they can select that, make it very easy, right? Choose one for Monday, two for Tuesday, and then choose the time of day that you would like. And then 1 for AM, 2 for PM. And then the next appointment or the next message they're getting is their new appointment time, right? So that you're using text to get them all the way through every step. You're not telling them that they have to step out of their comfort zone. You're letting them stay there. And all of those features and functionality are all part of the application and can be set and tuned to work with your files.
And all the texting occurs, I think this is kind of obvious, but all the texting occurs on our end from this interface from their PC, correct? From the staff.
Right. So you're exactly right. You're exactly
using your phone or any of this.
Right. Now you can log in from a tablet or you can log in from a smartphone, but first of all, we're going to know that login occurred from that device, right? That external. And then it's going to be not as easy to work with if you're on a smartphone. I mean, you would be able to open up a case, have a conversation, things like that, but it's it's better, obviously, the way the structure is, the amount of features that are available. It's better when you're working on a PC or a laptop or a tablet.
But it is possible to do that, though, because I know when my field nurses are out in the field, sometimes they need to contact their clients.
Sure.
So,
yeah. If you're on a smartphone, you can absolutely go to the website and be logged in and open up a case and reply. Very easy. Smartphone works it really does. It works just as well. It's just you're looking at the screen. It's smaller, and you don't have a keyboard. You don't have the convenience you do when you're at a tablet or a PC or a laptop.
iPads to do that.
We'd have to check with IT on that too, Sherry, I think, because I don't know about the security concerns of an individual's smartphone.
Right, no, they can use their iPads when they're out there.
Oh, their iPads to do it.
Yeah, they can use their iPads when they're out there.
Okay, yeah.
Yeah,
That might
be
best.
best.
If it's a county-owned iPad, I'm fine with that. I don't, and I'm sure IT would be too.
Yep.
Yeah, it's already
And
locked
nothing,
down.
remember, nothing will be transported onto the device. It's all going to be in this website. And so you're not leaving a trail if you, for instance, have a conversation on the iPad. The website is storing and archiving all of that information separate from that device. So you're simply using the device as the tool that's accessing the website. Everything else is going to be external. It's going to be managed right by the website.
And that's no matter what device they use, correct?
That's correct. There won't be, and that's part of the reason for why you have it in this secure environment, is so that you're not leaving trails everywhere on all these other devices, where how are we going to get all of that information from that device? Now it's conversations that are, protected, and what are we going to do? We're going to take the device and try to, it's just a mess. So yeah, this is why things are in a website, and that it's all being stored and archived, and it's all being stored and archived according to HIPAA guidelines, so that you can pull your data, you can be audited. Everything is being done in this controlled environment.
I would still want to double check with Norm, Sherry, on smartphones. I'm pretty comfortable that the iPads would be fine because they're county-owned iPads, but I'd want to check smartphones.
Yeah. And then and have a check, and anything that we talked about as far as security. At the beginning, I mentioned that there's that HIPAA document. If you have somebody that is going to be scrutinizing that part, make sure they read over that white paper on our security, because that tells everything that we just talked about. That gives the details of it.
Yeah, I think I've seen that before because I know our WIC program is already using the service.
Okay.
So, this is Michelle Shoresman. I'm the compliance officer for the health agency, and we've got our program manager, Dave, sitting in here with me also. So
oh, good.
We'll take a second look at that and see if there's anything changed on it, and have our
Cool.
security look at it as well.
Okay. Any other questions?
Any other programs that have questions about it?
So going forward, how do we set it up for each individual section, Jonathan?
Okay, so what we do, guys, is we determine the need on a case-by-case basis, right? So we determine how each branch is going to be using the software, and then we work out how best to do that with the structures that we have, right? So we have a guide, like a little questionnaire that we can provide to department heads so that they can go through that questionnaire, answer the questions, and then that's going to send that back to us, and then that's going to help us with building out each of the programs or each of the use cases. So I think next steps would be to have a discussion amongst each other, right, as to what you saw today, and then what's going to work best for you. And then after we have this conversation, I'm going to send you that questionnaire. That questionnaire helps ask those very same questions. So then you can then send me the reconciliation of your meeting or your follow-up, your discussion, and then that completed form, and then we would go ahead, and if we have enough information on board at that time, we would go ahead and start to build out the campaigns or the queues. And once that starts, it's usually about a week, depending on how your particular use case is, how involved it is. But it could be as short as a couple days to as long as maybe a week to make sure that we get everything done according to your specs. But that's the process, and it's pretty painless. We authenticate all people who log in, right? So that's part of the getting started. Who's going to be logging in, so we get you going, and then we train so that you can manage your staff roster moving forward. If somebody leaves, you can deactivate their profile instantly, so that we train you on all that, so that you know how to do that. You're not relying on us to do those things.
One more question, Jonathan. So if I were to understand this correctly, we would have to, in order for a client to use this service, they would have to sign some sort of authorization or opt-in form saying they wanted to participate in this and giving us the contact information they wanted us to use, the cell phone number, essentially. And then we set them up, or do they? Yeah,
like you can manage consent in a couple different ways. Health departments are one of the only, according to FCC guidelines, one of the only entities that can take a phone number, like a mobile number, and be on the phone with the person and say, do you mind if we text you that information? And if they consent verbally, you can send them content. You want to be fair about it. You want to tell them that they're going to get a text from the number 85511. That's the number we use for all of our texting. And you just want to let them know, but you're able to manage consent if you choose. You could actually manage consent verbally. You could also manage consent by, like you talked about, having a form and them consenting on the form, giving their written permission for you to text them. And so then that, yes, they could provide you with their mobile number, and then you could, what we refer to as profile build, which is to upload a group of mobile numbers to just simply get them into the software so that they're textable. And so that would be taking the numbers, putting them into an Excel spreadsheet, and then going to the admin tab and then adding them by fully opting them in, right? So that you've got your Excel spreadsheet, it's all ready to go. It's got the information on it. You can even build profiles like their name, their case manager, their date of birth, anything that's tied to that profile in another database can also be linked to their profile in PreventionPays, and it can be done rapidly and with one mouse click, right? Because it's taking that Excel spreadsheet and uploading it, and then that's it. It builds all those profiles. That's what we use a lot of Wix.
Do we have to have that before we can use the program with them?
Say it again.
Do we have to have that permission before we can use the texting program with them?
Yes.
If they have consented to communicate with you in the past, then we recommend just like sending an initial text when you first put them in the software, just saying, hey, we've added you to our text program. Please expect to get texts related to the health department, right? So that you're letting them know at the time when you're putting them in. But yeah, you can take clients that have given you permission to communicate with them and put them into the software. if you've got a list of numbers that are like cold call numbers, what you can do is you can authenticate them by going to the admin tab. You can partially opt in, and that you can send a mobile number or multiple mobile numbers an invitation to opt in, so that they're, hey, this is the health department. We saw that you have received information from us in the past. Would you like to get text from us? Reply in this way. And then they reply, and then, yep, go ahead.
The reason I asked is because on a lot of our referrals, the clients won't respond to a phone call and they won't respond to a voicemail, so we end up having to resort to a text message in order to get any contact.
That's fine. Yeah, and if they have communicated with you in the past, then that's absolutely fine, because that's what happens there is that's that golden pathway to communication. Suddenly,
no, these are brand new.
Sherry, I think we should talk to Linda McClure about how she's been doing this, and make sure that I'm sure that if other people, if you've already had clients consent to communicating with them via text, that it probably won't be a big deal to start utilizing this system to communicate with them, as sort of Jonathan's implying. But for new clients, I'd like to make sure that that if county council thinks we need to get consent, that we make sure we have that in place before we start texting new clients.
This is Francesca. We have a consent form we were using with our medical therapy clients that I could share with you guys.
Well, we have I know that we've got, I'm guessing that it's probably the same one that Rick just showed me recently, and so hopefully we're all using the same texting consent form. If not, then this is a good opportunity to make sure that we start doing that.
Right, and we use it.
Yeah, and you could have a group of clients that are, that haven't responded to phone calls, right? Where you send out, you go, okay, we're going to take that list of mobile numbers and we're going to send them a message and we're going to try to communicate. Now be careful, because if you have a list of 50 numbers or something like that, then your queue is going to be, you're going to get a bunch of responses. And so you want to just make sure that you're measured in doing that. And maybe break it down into groups of 10 numbers at a time or something, where you're sending that message out and see what kind of response. Usually it's very good. If you phrase your message right, and you say, we've tried to call you and we've been unsuccessful, things like that, then usually you get, as long as you announce yourself clearly, this is the health department, usually you get a really good response rate. So be careful on how you use that. But yeah, that would be an instance where you could upload the list of numbers, and these are numbers that we've tried to call, but we haven't been successful. So we're just going to send a message to them all at once, asking them to please text back so that we can continue to serve them. And if you're doing that, it's just literally, it's like your Excel spreadsheet, and it can be a single column header phone with the mobile number. And then, or you could just copy and paste your mobile numbers into the box, just comma separate them. Very easy.
I have another quick question. On that group message, when you send out a message like that with different phone numbers, does any other client see those other phone numbers, or is that hidden?
No,
Okay.
Everything's hidden. So no client sees other people's messages, nor does any client see other people's phone numbers.
That's what I wanted to make sure of.
The only communication they're going to get is what you send them, and it'll only come from the number that we assign. So the number that you're assigned, that will be the number that they will always get text from. It doesn't switch it up on them, and that, because I get that. It's horrible to get messages from random numbers, and I have no idea who you are, and I don't know if you're my dentist or you're somebody trying to get me to refinance or something like that. I don't know, and so it frustrates me. So being consistent with your communication, and then knowing that they're always going to get that message from that same number, it works to your advantage. Okay, guys, any other questions?
I think we're good for now, Jonathan. We might come up
Okay.
with some.
Okay, so when we get off the phone, I'm going to send the information to Sherry on next steps, and then you guys just go ahead and work out some logistics on your side. I know you've got some things to talk through, so please do so, and then utilize the content, the FTP, and then also that questionnaire that I'm gonna send you that helps define your program, and then we'll reconvene. Okay?
All right, thanks, Jonathan.
This